Now, another potential target are those patients that have the interferon gene signature. In clinical practice, it's probably about 50%, but here in the Illuminate trial, you can see it's even higher. I think, of course, because our randomized clinical trials are enrolling sicker patients than we see in our clinical practice. In the anifrolumab phase 2 trial, there was great efficacy of the anti-interferon alpha receptor blocker. And in fact, you see that this efficacy, the delta, was shown in those patients that had the interferon gene signature. As expected, there wasn't a delta versus standard of care in patients who did not have the interferon alpha gene signature. This was a very strong phase 2 trial because it required not just a reduction in the SRI, but a reduction in the steroid dose for the patient to be considered a responder. Unfortunately, there's been a major shock in that the first of the two phase 3 trials of anifrolumab has been reported to be negative. We'll have to wait for the second trial and for sub-analyses to try to figure out how, when there was such a positive phase 2, the phase 3 was negative.